So the bladder meeting has now been running for some years. I remember the first meeting in Brussels, and that was the first time we'd had an international meeting specifically dedicated to the clinical aspects of urothelial cancers. And so it's really good that this meeting continues. And actually, it's essentially it's a review meeting. It's not people aren't usually presenting new data at this meeting, but it's a really good forum to talk to your peers. And it's very multidisciplinary. For me, one of the real actual highlights of this meeting, and has always been the case in the times I've attended, is actually not just the multidisciplinarity of the doctors, but also the non-doctor healthcare professionals, but also patient representatives. And there was a really good session about cystectomy and the priorities that patients put upon this, and there were 2 cystectomy patients, one from the UK, one from Europe, who gave their perspective, and that's really good to see, because I think we've been quite poor in our ability to bring in the patient viewpoint into these sort of more scientific exchanges in the past, and I hope to see more of that. In addition to that, there was I attended a really great session about non-muscle invasive bladder cancer. Of course, this is an area where, as an oncologist, we don't yet routinely see these patients, although immunotherapy is now licensed in North America, at least, in this condition. And of course, there are multiple phase 3 trials, some ongoing, some of which have completed accrual with immunotherapy in non-muscle invasive bladder cancer. So it's really an area that we as oncologists need to get to learn a lot more about, because we're almost certainly going to be treating these patients, I would suspect, in the not too distant future. And it was really good to see how much is being done there, and what a difference we can hopefully make for these patients if these trials come through positive.